Everyone, welcome back to our YouTube channel Sowkya Med Vision. We are discussing about the bones of upper limb. We have started the series of upper limb. In the last class, we have dealt about clavicle, the collarbone, the features, anatomical position and attachments and the joints by collarbone. Today we are going for discussion of scapula. Yes, it is a shoulder blade. It is a thin, flat, triangular bone. Let's see the description of scapula. Yes, here we go. Scapula, it is also known as shoulder blade. It is also known as shoulder blade. And flattened, as I said, it is a flattened bone. It is not rather a long bone, but it is a flattened triangular bone. It is an irregular bone, okay? Now, it is presented posterolateral part of thorax. Yes, it is presented posterolateral part of the thorax. It is not in the axial region, but part from the axial region. It is presented in the thorax, in the posterior region. Yes, and it is extended between second to seventh rib. It is extended between second to seventh rib. Yes, now let's see the parts of the scapula. See, it has a large body. This is the body of the scapula, and it contains three processes. What are the processes? The spinous process, acromion process and coracoid process. There are three processes: spinous, acromion and coracoid processes. The body, this is the body of the scapula. Let's imagine this is the body of scapula. See, as it is anteriorly we are viewing, this is the anterior view and this will be the dorsal view. Yes, this will be the anterior, also called ventral or costal surface, having two surfaces, costal surface and the dorsal surface. Yes, the body containing two surfaces and three borders. What are the three borders? See, this will be the superior border. This will be the lateral border. The lateral border is continuation from the cavity called glenoid cavity. This is the glenoid cavity involved in the formation of shoulder joint. Yes, it is involved in the formation of shoulder joint. And now, three angles. What are the three angles? This will be the lateral angle. Here it will be the superior angle, and here it is the inferior angle downwards. Yes, inferior angle. Now let's see the side determination of the scapula. Glenoid cavity. As we said, the glenoid cavity is presented towards the lateral border. Hence, it is presented laterally. Yes. And now, costal surface. As I said, the anterior ventral surface will be the costal surface. Obviously, it is towards the ribs. So it is a costal surface which is concave. You imagine this is a scapula which is concave anteriorly. Yes, it is not flat, but it is concave. Costal surface concave ventrally. Inferior angle is below, that is downwards. That is downwards. Now, spinous process. What is spinous process? The spinous process is a process of scapula presented in the dorsal surface of the scapula. See, this will be the anterior view, that is costal surface. This is the dorsal view, that is the posteriorly presented, containing a process. This is the elevation, this is a process like ridge. It is known as spinous process. Yes, the dorsal surface containing spinous process towards posteriorly. Yes, this is the costal surface presented anteriorly. Spinous process, it is presented dorsally, dividing dorsal surface into supraspinous and infraspinous fossa. Yes. And now, what are the features of the scapula? As we said, it has two surfaces, costal surface and the dorsal surface. Costal surface, also known as anterior surface, it contains subscapular fossa. See, this is the costal surface. It is not flat. It is concave. So this concavity is for what? Insertion or origin of subscapular muscle. So this fossa is obviously called subscapular fossa for the attachment of subscapularis muscle. Yes, the costal surface containing subscapular fossa for subscapular muscles attachment, and the dorsal surface, or I said posterior surface, it contains spinous process. As I said, it contains a spinous process. This is a spinous process. Yes, so the spinous process dividing, this is a spinous process dividing dorsum of the scapula into supraspinous and the infraspinous. Supra means above the spinous, infra means below the spinous. Yes, the supraspinous provides attachment of supraspinatus muscle, whereas infraspinous gives attachment of infraspinous muscle. Here will be the supraspinous muscle, here will be the infraspinous muscle. Yes, and now superior border. There are three borders again: superior border, lateral border, and the medial border. The superior border containing suprascapular notch. See, this is a suprascapular notch. Here, this is a suprascapular notch in the superior border. This suprascapular notch is converted into foramen. See, suprascapular notch is converted into foramen by what? Converted into foramen by superior transverse ligament. Yes, by this ligament the foramen is formed. Suprascapular notch is formed into foramen by supratransverse ligament. Yes, it is presented in the superior border. And now lateral border. The lateral border is very thicker than the medial and the superior. From glenoid cavity to inferior angle, as I said, the lateral border is extending from the glenoid cavity. This is the glenoid cavity, extending from glenoid cavity to the inferior angle. Yes, this will become the lateral border, which is thicker. And the medial border, it is also known as vertebral border. Why? It is closely related to, it is near to vertebra. Yes, hence it is known as vertebral border. It contains root of spine. What is the spinous process? This is a spinous process. The attachment of spinous process to the medial border is known as root of spine. The point where the spinous process is starting, it is known as root of spine. Yes, and now what are the angles? What are the three angles? Inferior angle, superior angle, and the lateral angle. In the starting we have said that it extending from 2nd to 7th rib. So the superior angle is present at the level of 2nd rib. Yes, and inferior angle is present at the level of 7th rib. And the lateral angle containing obviously the glenoid cavity for the articulation with head of humerus in the formation of shoulder joint. Yes, and now let's see the processes. There are three processes: spinous process, acromion process, and coracoid process. Spinous process containing spine of scapula. Yes, spinous process containing spine of scapula. Acromion process, or it is also known as acromion, it contains subacromial bursa, which plays a major role in the functioning of shoulder joint. Yes, it is a bursa present below the acromion process. This is the acromion process. Here somewhere the bursa is presented, involved in the formation of shoulder joint. Yes. Now coracoid process. This hook-like beak, it is like a beak, right? Beak. So it is known as coracoid process. It gives attachment of three muscles and three ligaments. What are the three muscles? Short head of biceps, coracobrachialis, and pectoralis minor. In the last class we have discussed about pectoralis major. Here comes pectoralis minor. Yes, and what are the three ligaments? Coracoacromial, coracoclavicular, coracobrachialis. Coracoacromial means it extending from coracoid process to acromion, and the coracoclavicular, it is extending from coracoid process to clavicle, and again the coracobrachialis ligament. Let's see the ossification of the scapula. It is a cartilaginous ossification. Obviously, any bone from the cartilage except what? Let me know in the comment. 8 centers. It is developed from 8 centers, 1 primary for the body and 7 secondary, in which 2 secondary centers for one coracoid process and 2 secondary centers for acromion process. In the remaining 3, 1 for medial border, 1 for inferior angle, 1 for glenoid cavity. Yes, let's quickly review the scapula. See, this is the complete attachment and the features of the scapula. As we said, body containing 2 surfaces, costal surface and the dorsal surface. Costal surface, what? Subscapular fossa, containing attachment of subscapular muscle. Yes, in the dorsally, the spinous process dividing dorsum into supraspinous, infraspinous for supraspinous muscle, infraspinous muscle. And again, the glenoid cavity presented laterally at the head, laterally for the articulation of humerus, and the coracoid process, which is beak-like, and another process, acromion process, and third process is spinous process. Yes, let's see the borders. This will be the lateral border, and this is a medial border giving insertion. In the last class, I have said that blue color indicates insertion and the red or pink color indicates origin. Insertion of serratus anterior. What is the meaning of serratus? Serratus means digitations. This is not a flat muscle, it has the digitations like this. And anterior, the serratus muscle is also presented in the back of body, known as posterior. So the muscle presented anteriorly is known as serratus anterior. This will be the medial border. And in the superior border, we have suprascapular notch is formed into suprascapular foramen. In the inferior angle, we have attachment of latissimus dorsi. See, this is the latissimus dorsi. In the last class, I have said that latissimus dorsi is a broad muscle in the dorsum of the body. And now, superior angle is presented at the second rib, at the level of second rib. Inferior angle is presented at the 7th rib. Yes, lateral angle represents glenoid cavity. Yes, now the laterally there are 3 main muscles ka origin. Teres minor, teres major. Teres minor is circumferred by, splitted by, pierced by one artery known as circumflex scapular artery, dividing teres minor into 2 segments, and another teres major, obviously the latissimus dorsi, in the inferior angle of the scapula. So this is a brief discussion about the scapula. If you have any doubt, feel free to comment in the comment box. If you like the video, please do like and subscribe the channel. Thank you.